Seems to me, tell me if you agree with this or not, there's a basic philosophical difference between you and maybe some of the folks who are showing up at the demonstrations. You said to Isadora, for example, you don't think, I forget what your line was.
There's no question, there's a philosophical difference. And I can make an easy point to describe just how we are at different places at life in this. And you could see this at different town halls and events where this is played out. One of the most common arguments that I get today about healthcare is not, and this largely comes from the indivisible groups, it's not acknowledging that there was major problems with the ACA. Largely, many people are at the point that says, yes, major issues with the ACA, my premiums went up, my deductibles went up, big problems.
Right.
But the philosophical divide that is very easily seen is those that want to make the jump to saying, this is why we need Medicare for all. We need this single-payer, third-party system, and then those of us that are on the other camp that are moving away from that, saying no, this is why we need to give more control back to the individual to go out there. So yes, that is a big philosophical divide.
Right, and you said something along the lines of in the earlier interview that you don't believe in spending money or going into debt, spending money that we don't have. Whereas the people on the other side would say they believe healthcare to be a right, and that there's a moral imperative to spend this money to help, extend coverage, that sort of thing. Do you believe healthcare is a right?
So that's an important thing when you talk about, and you specifically use the words, right. Are you saying that everybody has the right to have it? Absolutely. And should nobody be barred from getting it? Absolutely. But does that mean that somebody else's tax dollars should be paying for it? Does that mean that the money that's taken out of your check, because the money in Washington, D.C., it doesn't come out of thin air, and unfortunately much of it is borrowed today. This is money that is not even coming in terms of revenue. It's not created out of thin air. It comes out of somebody's pocket. That money is the work of somebody else's hand. So when you're arguing for anything like that, you're saying you want somebody else to pay for your health care. That is the argument that's really going on right there. So yeah, that's an important conversation to have. People get the right to have it, but that doesn't mean that they have the right to have somebody else pay for it.
Right.
And that's the philosophical divide.
Right, exactly. And